Do you know how to teach hand washing, helping a child put on a coat, potty training, using utensils? If not, today we're going to talk about the number one tool you can use when teaching any self-care skill to a child with autism or a toddler showing signs, or really to any child, because there's nothing about my techniques that don't work with a child with no delays either. So today we're going to talk about self-care skills and how to teach them using the 4-step Turn Autism Around approach. Let's get to it. Welcome back. Today, we're going to talk about a very important topic, and that being self-care skills and adaptive skills. We're talking dressing, grooming, eating, and potty training. Those are really the big 4 categories of self-care skills that I talk about in my Turn Autism Around book, that I talk about within my online courses. And but I know we haven't done a specific video about this number one tool that I'm going to tell you about in a little bit. So the way we tackle things here within my company is we use a 4-step Turn Autism Around approach, that being assessment, planning, teaching, and evaluating using easy data. So I'm going to walk us right through how to use the Turn Autism Around approach. And when we get to the planning step, that's when I'm going to tell you about the tool that is so important for any self-care tasks. So kids with autism and toddlers showing signs of autism are often delayed, not just with language, and they're not just having some more problem behaviors than typically developing kids, but they also tend to be delayed with drinking out of an open cup, getting rid of a bottle, using utensils. They tend to be delayed with dressing, like putting on their coat at preschool, taking off and helping, dress themselves. They tend to be delayed with toothbrushing or have problem behaviors related to toothbrushing or hand washing. And usually potty training is a whole nother situation where it's a lot of issues. So in Turn Autism Around, the book, I do have chapters on picky eating, sleeping, which is an important skill, not really related so much. I have a chapter on potty training, and through our assessments, we do look at grooming and dressing as well. Okay, so the first thing to start with is step 1 of the Turn Autism Around approach, which is assessment. A couple of weeks ago, we can link it in the show notes, I did a whole episode on 3 really important assessments you can do for free. I have another assessment you can do for free related to self-care skills. So on the book resources, turnautismaround.com for your free book resources, under chapter 4, we have self-care checklist. Now, this is Dr. Mark Sundberg, who wrote the BB map. He wrote the self-care checklist way back, more than a decade ago. And this is labeled 2013, but this is really important. It's not actually a part of the BB map, but it's a supplement to it. And Dr. Sundberg, is a friend of mine and a colleague and a huge supporter and a teacher of mine. He did give me permission to include a lot of the self-care checklists within the Turn Autism Around book. So I have access to be able to give you access and to talk about it freely. So we have, if you download the self-care checklist for free, you will see a whole section on dressing, grooming, eating, and potty. So just going down here briefly, and Dr. Sundberg took child development scales and he tested these out, and by about 18 months, for instance, under the dressing category, a child should be able to pull his hat off, take his socks off, pull mittens off, pull shoes off, pull coats off, pull pants down and pull pants up with some assistance over a diaper or with buttoning, snapping, and zipping. So your child may or may not be able to do that, or clients. And then at about 30 months of age, the child should be able to, he goes on and on about untying shoelaces, unbuttoning, fastens, Velcro, removes shirt, removes pants or skirts, puts on shoes, may need help discriminating right from left, puts on pants, adjusts clothing. You get the idea. There's some skills. And then by about 48 months, by 4 years of age, a child should be undressing, dressing, putting on, all garments, putting on shoes, and hanging up things, putting things in hampers. So it's really laid out. So you can, if you have a 3-year-old or 4-year-old or 10-year-old, you can begin to check off what they can and can't do. Hey there, it's Mary, and I'm just breaking in to let you know about a special offer we have just created. So it is a 5 days to more talking, do-it-yourself mini course. You can start it today and get through the content and really see hopefully a dramatic increase in language. We have a special rate right now, 50% off. And if you use the coupon code podcast when you're checking out, you will get an extra $10 off. This is for a limited time, so get all the details at marybarbera.com/5 days. And don't forget the coupon code podcast. Now let's get back to the episode. So the same things, the same kind of breakdown for bathing and grooming in terms of brushing teeth, washing hands, brushing hair, wiping nose, blowing nose. That's all in the grooming category. Then in the feeding category, we have really important. We don't just jump down to utensils. What the really critical skills for, not just for feeding, but also for talking, is drinking from a cup, an open cup, and also sucking through a straw. Really important skills for an 18-month-old. And then using spoon to scoop food and eating finger foods. So if your child, no matter what their age is, if they're 18 months old or older, or even in their teens, and they can't drink from a straw or can't drink from an open cup without spilling, these are really critical skills, like I said, not just for feeding, but also for talking. And then he gets into, using a fork and eventually knives and helping set tables and all kinds of things under feeding. And then, of course, we have potty training, which the self-care checklist doesn't start till 24 months, and then 36 months and 48 months. We're not really going to dive into much to potty training because it's a lot of different skills. And what I tell people, as really a potty training expert, I believe, because I'm both a registered nurse and a behavior analyst, is that there are a lot of prerequisite skills to potty training in terms of pulling up and down pants would be a great skill to teach. Washing hands without a fuss to start, and then without help. Those are really critical. Also, sitting and attending and accepting reinforcement, waiting, all those skills are really good before you engage in potty training. So that's the assessment phase. Is you're going to want to go to turnautismaround.com, scroll down to chapter 4, print out your self-care checklist, and complete that for your child. Also, so the step number 2 is planning. So we don't want to work on everything at once. We don't want to go, oh gosh, his dressing is a mess. He needs to work on his code, and he can't pull off his socks, and he can't, he can't do anything. So we're just going to work on everything. Well, that doesn't really make sense. What I would recommend in terms of dressing or any of these skills is look at the 18-month skills, see what the biggest thing is they can't, well, it's not developmentally appropriate to work on putting on socks and shoes before they can pull them off. Pulling off the shoes and socks would be first, and then putting on might be second. So you might think, well, putting on a coat is more important at preschool or daycare. So just pick a skill. And that's what you're going to work on. Now, in terms of planning, I also have a video for free on YouTube and on my site, marybarbera.com/hand washing, with little Cody and some of the things we tried. And it's about a 15-minute bonus video that I have for free since COVID. So you can watch that. And I also have a shoe tying video with Lucas learning to tie his shoes. So you can also watch that if your child is further along and you want to get some ideas on how to do that. So in terms of the planning, there's the number one tool that I would use is called task analysis. And that sounds like complicated, and it basically means breaking down the tasks, writing down the steps in order of the task so that you can help the child become more independent, not with the whole task, with the components or the steps of the task analysis. So if you're a parent, I think my book plus even writing down a task analysis on a form or on a piece of loose leaf is great. If you're a professional who works with a lot of clients, this book is called Self-Help Skills for People with Autism, a Systematic Teaching Approach. That's where I got the task analysis sheet on page 183. It is written by a few BCBAs and a few PhDs, a PsyD. So it's a great book to learn how to break things down. But basically, the number one tool to use to teach any self-care skills is to break down the tasks on a task analysis sheet, and then to take data as you wash hands, for instance. And for Cody, for example, if you watch the video on YouTube or on my site, you'll see the task analysis that we did for him many years ago. And the tasks are now even that's why I put this in planning, because this isn't like something you figure out while you're teaching in the moment. Like, this has to be planned. If you really want a systematic approach and you want to get over the hump of how to teach something like hand washing, I think that's a good example because it involves multiple steps. And I have really good videos of that. We can link in the show notes so you can watch the whole 15-minute video. But another important thing is when you are doing the steps to pick 5 words or less to describe each step. So in Cody's example, we put push up sleeves, turn water on, wet hands, get soap, rub hands, and then in parentheses, we have count to 5 while we're rubbing hands. Hands underwater, turn water off, dry hands. How do we come up with these steps? I had Mom do it. Mom and I created the steps with Cody in another room where we could write it down. We could think. You could do it yourself and think of the steps. You could do it with a typically developing sibling or another child who can wash his hands, and you can watch the situation. The other important thing in the planning step is pick one bathroom if possible, pick the sink, have the same, if you're going to have foam soap or you're going to have automatic soap or you're going to have regular soap, because that will determine how many pumps or what the situation is. If you have all different sinks and bathrooms where you're trying to do this step, it will be a little bit harder to teach. The other thing you have to plan for is you want this to be reinforcing. So if a kid is already freaking out, doesn't let you wash his hands, doesn't participate, then we don't want to go right away to the task analysis. We might need to get a stool so that they can reach. We might need to make it more fun. We might need to have them play with water a little bit. But if they're ready to go, then breaking things down in a task analysis is best. Okay, the other thing to mention is you'll want to plan for reinforcement. Are they going to get reinforced right after this task analysis session? Are they going to, you could use a clicker where you give them points once they do each step. But one of the things you don't want to do is you don't want to interrupt the chain of all of these steps together by saying, good job, or that was so awesome the way you did. You know, you want to be really quiet as the child is going through the steps, except for to say the different steps. And I know this is different. A lot of you are behavior analysts and you've been trained not to talk in between. I have found that using the same words in the same order and fading prompts from behind is really the best situation. So I'm not a fan of little visuals and not saying anything. I don't think that really leads to the kind of independence that we see by using these procedures. So we went over assessment, we went over planning and the tool, which is task analysis. And now with teaching, we want to, whenever possible, prompt from behind. So get behind the child in a gentle, child-friendly way, positive. Sit behind the child if they're learning to put socks on. Have bigger socks than they wear because it'll be easier. If hand washing, get behind the child so you can gently prompt if needed to go through the steps. You're definitely going to have reinforcement of some kind. And it could be, okay, first we're going to practice washing our hands and then we're going to go outside. And then when we come back inside, which is a more natural time to wash hands, okay, let's wash our hands and then we get a snack. So we can have practice sessions 4, 5, 10 times a day to get these verbal prompts or gestural prompts into independence. And that's how we take data, which is our final step of the Turn Autism Around approach, is evaluate using easy data. So we can see within, a few days, really just 3 or 4 days, Cody got a lot more independent with many of these steps. He also was pretty resistant. So we used video modeling, which is described on the video that you can watch about hand washing. I also did another podcast on video modeling. We can link in the show notes. So child has to be happy. You need to have a task analysis to really make the most progress. You need to practice with these steps in the same location if at all possible. If you're working on putting on a coat, it's not different coats, it's not different styles, it's one coat. We're going to practice 4 times a day. And it doesn't have to be the natural times when it makes sense for any of these skills. It could be literally practicing putting a shirt on 5 times a day, 10 times a day, outside of the dressing routine. Because we want to be practicing, but we want to be practicing correct. We don't want errors. We want as fluent progress as possible. So the number one tool you can use to teach any self-care skills is a task analysis, but I've covered so much here. You can get some of the self-care checklists embedded in the chapters at turnautismaround.com. You can also get get the book resources, which is going to be helpful for downloading things. And I hope you can start making some progress with these self-care skills, which are super important. Don't just work on language skills and problem behavior. These self-care skills, which are covered everywhere I go in my digital assessment, in the book, there's a chapter in my online courses. It's pivotal that we start at the right place or restart at the right place. Maybe you've had failures with these teaching these different things. I have a good way for most kids. If you want to learn more, just go to turnautismaround.com, download your free book resources, and take the first step to helping your child or client with autism or toddler showing signs, or really any child who needs help with these skills. Hope you enjoyed this episode. I will see you next week, same time, same place.